Good morning. I would like to invite you to a special webinar coming to you from the Southeastern Coastal Center for Agricultural Health and Safety for our Community Stakeholder Advisory Board members. I'm Tracy Ronnie, and I am the Outreach Corps Director for the Center. I'm also a professor and chair of the Department of Family, Youth, and Community Sciences at the University of Florida. I want to talk a little bit about some housekeeping details and then give you a sense of what we're going to be talking about today. So first off, this session is being recorded and we will be sending out to our members after the recording is done today. I wanted to let you know that we will be having a main presenter. I'll be introducing him in a minute, and we will be using the chat box for question and answers. And after our main presentation, we will be taking questions if you have any. I want to also reference you to our website, which you see up on the slide. That's where all of our materials are housed and archived and where you can get information about what the center is doing at any point in time. So I'm wanting to give you a few updates and then we'll get started with our main presentation. So we're really here today to talk a little bit about the State of the Science meeting that the center recently held in St. Pete Beach in Florida at the end of October. The topic for that meeting was heat-related illness, which is a cross-cutting issue across agricultural production as well as other sectors, including sports as well as the military. And the purpose of this meeting was to bring together researchers at the intersections of heat-related illness, public health, and climate science. It's getting hotter in the Southeast, and as a result, people who are living and working outdoors are more at risk for illness caused by heat. We wanted to provide a forum for researchers from a variety of disciplines to discuss current findings and adapt what we learned to protect the lives of outdoor workers. We found some very interesting things. We brought in researchers who look at agricultural health and safety, heat-related illness, but we also had researchers from the worlds of sports and also the military. We're going to be talking about what they presented in a few minutes. I did also want to give you an update as to some new programs that the center is currently conducting. We have just started a webinar series, which we kicked off in September, that happens monthly. And we will be bringing to you researchers who focus on all aspects of agricultural health and safety across our three sectors: agriculture, forestry, and fisheries. Again, go to our website where you get all the information about where and when and who. You also should be aware that we're starting an affiliate member program, and you might have received an email about that. And that is a special sign up that is available on our website and gives you the opportunity to get the latest information from the center and our activities, allows you to suggest webinar guest speakers, and gives you the latest in updates about opportunities such as our pilot research project program. We also have a fall seminar speaker that you might have received some information on, and he is coming to campus here in Gainesville on November 15th. And his name is Jose Perez, and he is the Senior Manager for Health and Safety at The Wonderful Company, which is a large-scale agribusiness food production company. He's going to be talking about creating a culture of safety in organizations both large and small, and he's going to be talking about his story, and I think you'll find him very interesting. We've already recorded a webinar, and that is going to be made available. We'll be sending that out to you, so if you're not able to be here in person, I know many members are not local to Gainesville, you can be able to access that webinar again from our website. So at this point, I want to first introduce a short video which captures some highlights from that day when we held the State of the Science Heat-Related Illness meeting, and then I'm going to be introducing our main presenter.
So for the heat-related illness State of the Science meeting, what we're trying to do is bring together researchers from a variety of disciplines who work on heat-related illness, but with different target populations. We have researchers in our center that work on it with farm workers. We also work with landscapers and nursery growers, but we're also going to be hearing from researchers who work with athletes, as well as some who work with the military. The fact that heat-related illness is such a cross-cutting issue is one of the reasons that we're trying to put this meeting together. We'd like to have researchers talk about where this research is going, form collaborations and partnerships, maybe identify sources for collaborative funding across several different funding agencies.
We're reaching a time where temperatures are going up. There is also an increasing awareness of some of the long-term health consequences that can result from heat stress. And so consequently, we felt it was time to bring together experts and really begin to focus on this issue, but in this case, to focus on what we know about agriculture specifically, which is where our particular center is focused.
A meeting like this brings together expertise from all over the country for people who deal with heat-related issues for various reasons. Obviously, you have different occupational practices where they may be wearing personal protective equipment that increases their, their heat-related stress, or obviously working in the fields in hot conditions. And a lot of the researchers and people that deal with translating the research to help these populations working around the country deal with these issues a little bit differently. So it's good to hear kind of how others have tackled the problems and hopefully learn lessons there.
So now I'd like to introduce our presenter who presented at the State of the Science Heat-Related Illness meeting. And I'm very happy to introduce to you Dr. Tom Bernard. He's a professor of environmental and occupational health at the University of South Florida. And he's also the director of the Sunshine Education and Research Center, an ERC that's based at the University of South Florida, and partnered with us on this meeting that we held in late October. So I'm going to turn things over to Dr. Bernard.
Thank you, Tracy. I'd like to just spend a few minutes with you to, summarizing the results, I think, or the major points from this meeting. So if we can proceed through to my slides. So it will be a recap. It was just a couple of weeks ago. It was at a fantastic venue, which certainly put the right kind of enjoyment and perspective together. There were, on the next slide, I did make a presentation, but there were a number of others that were there, and it was a wonderful opportunity to meet with all of these people, sometimes repeat or renew friendships. There was a couple of new ones that were there. And as Tracy mentioned, it was cut across a broad range of experience and expertise. So I do appreciate that. So the basic themes that were covered really has to do with climate. We will talk a bit about climate change, but what's important is also today's climate. It focused on outdoor workers and including farm workers, and the experience they have with heat stress, strain, and heat disorders. Some implications on exposures. We'll talk for a moment on acclimatization, touching on some management, training, and emergency response, and then a quick update on a couple of directions that we might go. So on the so addressing first are just observations among outdoor workers. And this slide and the next will summarize some studies. I can't emphasize enough to you that we have really just kind of nailed down the relationship between heat-related illness and the ambient conditions. And it's temperature and humidity. Humidity plays a very important role. It's true whether you're just looking at first aid cases in occupational settings, whether you're looking for hospital treatment, um, where it's related to occupational exposures, and then certainly to fatalities. So it is a broad range of outcomes, all of them related to the level of heat in the ambient environment. Among farm workers in Florida, we have repeated observations of high and excessive heat strain. So it's outdoor workers in general, and it's farm workers in particular. There's also pretty good evidence that there's a carryover effect. That is that we like to believe that we start every day fresh and ready for work, and what happens the previous day we've completely recovered from. That's really, in the end, not the case. We have laboratory data from animal studies that clearly demonstrate physiological change, and I'll say that one more time later. We have good epidemiological data that points to the same thing. And while not discussed explicitly at the meeting, this has implications for heat waves. Whenever there's a sudden change in the environment, that impact is just emphasized. There's also good evidence for acute injuries. And while we've looked at acute injuries, what it really is are accidents, and accidents may not only be hurting people, but it can have an impact on the environment through spills. It can have effects on equipment, damaged equipment and things. So I think that heat stress ought to be considered not only in the context of heat-related disorders, but that it has a broader effect on overall. Now, on the next slide, we're going to have some specific observations that were done here in Florida by Linda McCauley among farm workers, and her findings demonstrated a number of things. One is that there's a progressive dehydration over the day. This was observed in practically every worker that they observed. So this, some came in dehydrated and got worse. A few came in reasonably well hydrated, but still were dehydrated by the end of the day. So this is just everybody. And that wasn't terribly surprising. We've seen that in a number of other places. Half of the workers in the study reported symptoms of heat disorders. So this is kind of important. It really means that we've pushed them out to an edge. A quarter of the workers that they measured had core temperatures over 38.5. This is a marker for us. It's not yet at the danger level, but it starts to tell you that the heat stress isn't being managed. And just as importantly is that it wasn't just a brief dalliance with being over 38.5. On average, it was over 20 minutes, and many of them went out to hundreds of minutes. So this is, again, a good indicator of the strain. And then a fifth of the workers had very high sustained heart rates, which again indicate that two things. One is they're working hard, and they're working hard in the heat. And when you go back and look at all of these data, they are strongly related to the ambient heat. In other words, the dehydration gets worse, the symptoms are more frequent, more time above the body core temperature of 38.5, and very high heart rates. So clearly the ambient environment plays a role. The next slide is, I call it the pathway to disorder. It's a little bit of, or disaster. It's a little bit of an exaggeration, but not much. The point being is if you're in the top half of that figure, above that dashed red line, that's the normal physiological responses. We expect it, and in fact, it's desirable. It's how the body is adapting to the heat. But what happens is when you tip over that red line, you start to go into some physiological dysfunction. And that's kind of the yellow. That starts to tell us that the body's a bit stressed, and Dr. McCauley's data that I reported to you in the previous slide are some of those indications. And then when you get down to the pink, this is now where things have gotten out of control and lead to a catastrophic heat illness called heat stroke, which are frequently fatal. So I want to let you know that we operate on the edge and sometimes we'll tip over. So the next slide is a quick take on the presentation on climate change. A couple of things I want to point out is, first of all, Florida's coastal, and people like living on the coast. So not a surprise to anybody, we're going to see that kind of thing happen. But what that also means is there are increasing odds for extreme weather events, storms and winds and heavy rains. Again, not a surprise to anybody on the coast. And what that means is that there are greater impacts on the population. So when we do have an extreme weather event, we're going to not only have with the people living there, but it's all the people responsible for recoveries are going to be impacted by that. Another point is that there's more rain along the coasts in the projections, less rain in the rural areas. From an ecological point of view, that means that we're probably going to be doing more irrigation. Less important on the heat stress side, because it's still going to remain humid. So what really is typical of Florida and the Southeast is we are warm and humid. The models will predict that the temperatures are going to get higher. The humidity is not going to get less. So even though there might be a little bit lower rain levels, the effects of humidity will be potentiated, and then that means that then again the potential for heat stress exposures markedly increase. So not only are they high now, but they're going to get higher. And so with that kind of information in mind, the next slide starts to talk about, okay, how do we begin to assess that level of heat stress? How do we begin to plan what might be too much? So when we talk about risk factors, is that as an industrial hygienist, we usually look at what are the job risk factors. What's inherent in the job that's going to cause somebody to have a deleterious outcome. For heat stress, that's the environment, the heat and humidity. It's the work demands, how hard are they working, what are the metabolic rates, and then what clothing's being worn. And the note here is that when you start to see any sort of index on a website or any guidance you might get from an app, what those things are including are just these job risk factors. We do appreciate that there are personal risk factors that have a remarkable effect on risk. One of them is acclimatization state, and I will come back to that briefly again. Another is fitness and general health status. And really for personal risk factors, there's just many. I call out something important because there have been a number of case reports on heat strokes, and one that starts to come out is incentive pay. So this is an important job risk factor or a personal risk factor, however you want to frame what the effective incentive pay is. But individuals will begin to ignore their signs and symptoms as they push forward. When we look at these exposure limits that are broadly available, they're really set where most healthy workers can sustain that exposure for long periods of time. That means that there are other workers who can safely work above that. That's fine. It's just that we don't know who they are. And every time you start to push above this, there are more people working at that margin of safety. So remember that red dashed line I showed you on the physiological responses. It doesn't take much of an environmental push to take an individual over that red line into areas where it's difficult to cope with the environment. Now, on the next slide, we look at acclimatization. And one of the speakers did a great job of saying, he's looked at cold, he's looked at altitude, but heat is the one that very clearly people have a physiological adaptation to. So it's not only mentally tolerating heat better, but there are marked physiological advantages to this. And I'm not going to dwell on the table other than the fact that it says it takes anywhere from a few to 6 days to fully implement an acclimatization. And the next slide just kind of points out that you will lose acclimatization if you're away from heat stress, whether it's routine or due to an illness, and then it takes a little bit of time to re-establish that acclimatization. On the next slide, it's training. This is a theme that we see all through occupational health and safety. It's certainly embedded in regulations that encompass outdoor workers and farm workers in particular. So there are statutory requirements for training. There's really a general appreciation that training is very important. And part of what came out of the meeting was that we recognize that there are training needs. It's important to define what the relevant content is. So what is the evidence-based information that we need to convey to workers, supervisors? Just as important is that it be culturally relevant. We have issues of language, we have issues of idiom and symbols and how it is that we can convey what we know to be technically true to the people who are impacted by it. And this isn't done in a vacuum, but really requires complex interrelationships and partnerships that develops this material and then puts it into a format that can be delivered. An important message that was delivered about training at the meeting was that, first of all, it can change knowledge, and sometimes we just stop there and say, okay, if they know about it, good. But the other point is that it also affects behavior, and that is the bottom line. We need people to be able to operationalize and act on the knowledge that we give them. So I thought that was an important point that came out during the meeting. On the next slide, we have some lessons from athletics and what I really ought to add to that in the military. So in athletic events and in the military, there's a lot of good information on high levels of heat stress for short to long periods of time. And there are lessons that can be generally extrapolated to occupational environments. And one of them is that there should be very early recognition and treatment of heat-related illness. This is something that is key to protecting the health and well-being the workers. And so this is part of where the training is. People need to be able to recognize and treat heat-related illness. There were several presentations that pointed out that there really is a kind of progression. There's a heat exhaustion, which is a circulatory failure. The cardiovascular system just can't keep up. That begins, that early stage is below the red line. And then if there is a sustained failure of the cardiovascular system, then the temperature in the central nervous system begins to increase, and then you have basically brain dysfunction. What I like to tell people at this point is somebody might come up and tell you that they feel exhausted, lightheaded. That's a circulatory, that's a heart rate, or a cardiovascular response. Nobody is going to come up and tell you, I think I've got a heat stroke, because at that point you've got a failure of cognition as well as other things. So it's important that everybody learn to recognize what heat-related illnesses are. And then for heat stroke, both the military and the athletic community understand the importance of an immediate response because it is a medical emergency. A lot of organs are beginning to fail, and they're failing quickly. So that it's not a matter of calling 911 and waiting for somebody to show up. That clearly isn't an adequate plan. You need to recognize it quickly and take immediate action. Work, again, a theme both from the military and athletics, is that this requires some care and attention. If you have treated somebody well, they should be able to return without any problems, but there's no easy way to do it other than to slowly reintroduce them back to the environment and watch them. I provided a little crib sheet to the recognition and treatment for heat exhaustion and heat stroke that will be available to anybody on this. Just ask the staff at the Southeast Center, and they'll be able to provide that. Or you can get back in touch with me. On the next slide, then, my summary of this is that there really are two key recommendations. As an industrial hygienist, I have gobs and gobs of recommendations, but if I leave a simple message, one is that you have to train. You have to train on the signs of heat-related disorders, and those are things that you would see in somebody else, as well as what are the symptoms, which are things that you see in yourself. And then what are protective practices? And it's not only drinking water. We tend to treat that as a silver bullet. It's important, but it's not the only protective practice. And then the other message is have an emergency response plan. Again, I get involved in a lot of heat stroke cases, and the absence of an emergency response plan is just striking. So that would involve the early recognition of heat stroke. I put it in capital letters, but immediate, rapid, and aggressive cooling. This really means in an ideal situation, you drop somebody into an ice water bath. That's what the military and the sports people will do. But it's making good use of what you may have. If it's a tarp that you lay them on and just dump all your drinking water onto them, something that will cool them, and then arrange for emergency transport to a facility that is prepared to deal with a heat stroke case. This just then leads to the wrap-up slide, which are the panel direction. The scientists in the room just love the idea of having more laboratory and field work, answering scientific questions and on mechanisms and evaluation, put me into that camp. I was all over all the different possibilities that emerged. What was clear was for the people who had good experience with the farm workers is that these interventions that have been developed for other occupations, the military and sports, are not easily translated to a farm worker population. So we spent a little bit of time, I think, talking past each other. But the note I made to myself in the end is there are people who are clearly expert on training. There is clearly evidence-based knowledge that we have of what ought to be in that training, and that's the low-hanging fruit. And I think I intended that pun, even though it came naturally. But again, I want to thank the Southeast Coastal Center for the ability to participate in this, and I found it to be a rewarding event. And if you have any questions, I'd be happy to answer them now or at some other time. Thank you.
Thank you, Dr. Bernard, for that excellent recap of the heat-related illness State of the Science meeting. If anybody has any questions, if you type into the chat box, we will be able to take those questions and answer them for you. And while you're thinking of questions, I just wanted to make mention to Dr. Bernard. One of the reasons, and I think you mentioned this, that we brought in researchers from other disciplines, sports medicine and the military and climate science in particular, was we know that research has been going on in these areas, and we wanted to be able to kind of get what the state of their research was, and we also wanted to get some takeaways that we could perhaps be able to adapt to the agricultural context. You made mention just a few minutes ago about the idea of you could treat heat-related illness with something as simple as having a tarp and a bucket, a water bucket available. That came from one of the sports medicine researchers. I mean, that was a very striking moment, because those are things that could be part of an emergency response plan. So from your standpoint, going forward, what are the key takeaways in terms of things that we could bring to our stakeholders that would be practical, evidence-based kinds of approaches to preventing or treating heat-related illness?
Yes, so the secret, and the reason why I kind of provided that crib sheet is that I think appreciating what heat exhaustion looks like and how it is you treat it is important. That's very reversible. More often than not can be done in the field. Recovery is good, and people can return to work. The important message, though, also is that once you have a severe heat exhaustion, you don't yet quite know whether you might have pushed somebody to a heat stroke, but you need to be watching that. And you may have just missed the exhaustion and they've moved into a heat stroke. You need to be able to see that. Like I said, nobody's going to come up and tell you, I've got heat stroke. If you look at these case studies, and especially those that involve farm workers, you will see stories like they were feeling fatigued. They walked off to an area where they were isolated from everybody else, sat under a tree, and what happened is that they went unconscious, and their body heat just soared, and they died. There are lots of those kinds of stories that are there. So it's paying attention, and it's really now you're relying on somebody else to recognize that. Then what is equally clear is the treatment needs to begin immediately. The sports medicine people will say within 30 minutes. I think that that's a misleading piece of information, because that might tell people, well, I can call up 911 and they can be here in 20 minutes or so. The relationship's more complicated than that. And they're working under the context that they've got athletic trainers and others that really begin to know things and act appropriately. It is that really the more time you spend above, and pardon me for being technical for a moment, but the more time you spend above 40 degrees centigrade body core temperature, and the greater that elevation is above 40, risk increases substantially. So you don't want to second guess in an occupational environment. The military and sports people are more equipped. In an occupational environment, you want to treat people early rather than waiting for them to respond. I tell people, if you've got somebody who's not suffering a heat stroke, you throw them into that ice water bath, throw them in, well, not literally throw them into the lake or wherever it is you're going to try to cool them down, is that if they're not suffering a heat stroke, they'll come back and say, what the hell are you doing to me? And you can say, okay, well, maybe they're lucid and they're okay. But I'd rather make that mistake than hang around waiting for EMS to come up and say, you know what, that guy's really cooked. The other is that we are really kind of working where the knowledge is the self-empowering piece. I'm picking up from what we know, from what I'm beginning to learn about farm workers. They need the knowledge to start to make the kinds of decisions that they need to protect themselves. Like I said, it's not only drinking, but it's appreciating the state that their body's in, being aware of those symptoms and being aware of signs in their fellow workers. That's going to be important to manage that. And the guidance that you find is sometimes pretty vague about for instance, the OSHA campaign on water, shade, and rest is pretty vague in the end.
Mm-hmm.
And, you need something more concrete to operate under. Does that help? Did I avoid the question, or?
No, you answered it pretty well. Yes, I in just having listened to all the speakers, I would agree on the need for specificity. And some of the researchers, and you showed some of the tables, have done an excellent job of providing guidance as to how much is too much in terms of temperature, what reacclimatization schedules need to look like. They've got a lot of very specific insights that we can adapt. You mentioned athletic trainers, and I thought Dr. Rebecca Lopez, who's from USF, talked a little bit about how athletic trainers are allied health professionals. We may not think of them that way, but they actually are being hired in non-sports companies to provide occupational health training. And that is something that we might be able to think about ways in which we could collaborate and draw on that kind of expertise to translate and disseminate training information to producers and growers and farm workers and other kinds of outdoor workers. So one of the things that I found really interesting was that there are partners out there that we might not even have thought about who could really help us develop and adapt training.
Yeah, and what's important is that in that context of allied health professionals is, and it's coming true with this University of Maryland football player that died.
Yeah.
There wasn't an athletic trainer on site. They were relying on the coaches. The athletic trainers in sports environments do not report to coaches. They report to the medical staff. And that distinction is critically important because they want some independent observer helping to make decisions that isn't motivated by, if you will, productivity.
Right.
You know, so and there, this becomes some of the more subtle things that as we implement a health and safety program in a farm worker organization, how it is you look for these conflicting interests and how you manage them.
Right. And I don't know if we have any questions. Doesn't look like it, but certainly I've appreciated having the opportunity to be part of what we hope will be a regular occurrence, which is to have State of the Science meetings on topics that are important in agricultural health and safety. So for those of you who are listening to the webinar, if you have ideas as to things that you would like to see in terms of bringing together researchers across different disciplines who could focus on an area that really needs illumination and can give you information to protect your workers in workplaces in agriculture, forestry, and fisheries, definitely let myself or Dr. Bernard know. And we look forward to having you all tell us what you think about heat-related illness and how we can help you be able to prevent, treat, and manage that in your own organizational settings. So to wrap up, I want to thank Dr. Bernard. Thank you very much for providing a recap of our first State of the Science meeting for the Southeastern Coastal Center. I wanted to mention to our listeners that the State of the Science meeting deliverables, things that we're going to do as outcomes from this meeting, include some academic deliverables such as white papers. We're going to make the presenter videos and PDFs of their presentations available on the center's website. We will have some fact sheets, which will be training resources, and that will include the piece that Dr. Bernard mentioned in his talk. And we will be working with collaborators and partners to develop additional training tools that we'll make available for anybody who wants them. I want to wrap up by also mentioning that we have a date for our annual Community Stakeholder Advisory Board meeting. Right now, we're looking at March 14th, 2019. We've just selected that date. We need to clear and make sure that there's not any other competing events happening that our members might need to be at. So at this point, we'd like you to sort of pencil that in on your calendar, and we'll be providing some updates and finalizing the meeting agenda over the coming months. We're thinking about the location as being the UF-IFAS Mid-Florida Research and Education Center. That's based in Apopka, Florida. So it's a Central Florida location this time, and we hope you're going to be able to join us. So we'll be giving you more information as we move forward with plans for that annual meeting of our CSAB members. So thank you for your support of the center. Thanks to everyone who was involved in helping make our first State of the Science meeting successful. And we hope that you will let us know what you think and give us your ideas and insights as we move forward in making sure that the center's activities are outreached to our stakeholders and clientele throughout the Southeast region. Thank you.